Okay, we'll start in just one moment, everybody. Okay, if I can ask to please start the recording. Thank you very much, and good vach, everybody. I hope everybody is doing well. Hope everybody had a wonderful Shabbos. Can you hear me okay? Reb Shmuel, am I loud enough?
I hear you perfectly. Hope
Okay.
everybody else can as well.
Okay, please tell me if it's not loud enough.
Okay, put it on the chat if there's a difficult.
Okay, so good vach, everybody. We read about in the parasha today a number of interesting ideas related to serious illness and serious consequences of that, including we saw the death of Abram Avinu, we saw the death of Sarah Imenu, we saw the death in the Haftorah of David HaMelech. And I mentioned this morning, and I think it's kedai to just say it again quickly, what was the underlying similar theme between all of them? They all were called Zokain Ba Bayomim. We find this language of Ba Bayomim a very important language. So one of the explanations the Ramban and others say for this idea of Ba Bayomim is that each day of their lives they used in a way that was positive, and that each day of their lives they took those experiences and they gained from them. And that's what life is all about, to see what's going on and to adjust and to change, to improve. And that's how you become an Avram Avinu, a Sarah Imenu, a David HaMelech. They were Ba Bayomim. Each and every one of their experiences, they took, they looked at, and they grew from it. And that's why they became the Gedolim that they were. On the other hand, we see sometimes people don't learn and don't realize from what's going on around them, and they don't change, they don't improve. And those people, unfortunately, they're the people that are never satisfied with life. They're the people that are never happy with what they have. They're the Rishayim. The Ramban speaks about those people that always want more. They're not happy with what they have, and they don't realize the bracha in what they have. So this is to contrast Avram, Sarah, and David with the Rishayim. I'd like to further say a nice word. I once heard from a Herschel Schachter Shlita, where he said that we find that when a person commits a capital crime in Nebuch, Beis Din has to put him to death. So those murderers, those killers, those Mechalel Shabbos, whatever sin that they did, that they required a capital punishment. So Chazal go and they ultimately bury them. Why do they have to be buried? They're terrible people. What is the reason that we have to bury them? And the answer is that they also still have the Tzelem Elokim. They have the likeness of God in them. As bad as they are, they committed one of the four types of crimes for which you get capital punishment for. Skila, Sreifa, Hereg, V'chenek, all the different categories that fall within each of those four categories of crimes. Nevertheless, they require burial. They still have the Tzelem Elokim. And I think the connection between these two ideas, to me, is obvious. There are those of us that have learned our lessons and continue to hopefully improve our lives based upon our life experiences, based upon things that we've gone through. But even people that haven't learned their lesson, they still have the Tzelem Elokim, and it's never too late to learn the lesson. And I think this is extremely important when we're dealing with the lesson of COVID-19. Because I've talked about this now for months and months and months. I said I'm hoping I would be wrong. Nothing would please me more than to be wrong. But at the same time, unfortunately, we're seeing what some people are referring to as a second wave. I don't understand that terminology. It's not a medical terminology. But we're seeing a tremendous increase in cases locally, in the general greater New York City metropolitan area, Nassau County included in that, the surrounding states. We're seeing this in the United States, and we're seeing this in the world. And I just want to give you some idea of the numbers, because we're, Baruch Hashem, not seeing the numbers that we saw in March, April, and May. But the rest of the world is, in fact, higher. And just to give you some idea, in the United States, there are now more than 10 million cases of COVID. It's an astounding number. I remember when we were talking about would we reach even 1 million cases. Worldwide, there are more than 50 million cases. In the United States, Texas has surpassed itself 1 million cases. California has now surpassed 1 million cases. New York is in relatively good shape. Right now, we're the third best state in the United States. But the rest of the country is seeing horrific numbers. To give you an idea, we had never crossed 100,000 new cases in a day. We crossed that number about 10 days ago. For the last 10 days, we've had more than 100,000 cases each day, identified new cases of COVID-19. Today, there were 180,000 new cases of COVID-19. We're jumping by 10 and 20,000 additional new cases. We're breaking records. We have more COVID cases now in the United States, more hospitalizations. We have almost 70,000 hospitalized patients right now in the United States. The 10-day totals are higher, and our single-day totals right now are higher than they were in the middle of our personal New York City, Nassau County heights of the pandemic in April and May. The numbers across the United States right now are higher than that. We, Baruch Hashem, are still lower than where we were back in April and May, but I'll tell you our numbers in a second. And everybody says, oh, it's new testing. It's just testing. It's just testing. The number of tests versus the number of hospitalizations, there are far more percentage-wise hospitalizations than there are new tests. Again, we're seeing increased hospitalizations. No matter how much testing is being done, that is an indicator of serious illness. And we're seeing far greater numbers of hospitalizations now across the country, across the world, than we did back in April and May, when we saw astounding numbers here. They're predicting. Right now, there are, unfortunately, 240,000 deaths so far due to COVID in the United States. That's 250,000 people, Rahman al-Islam. They're predicting this number to continue to rise at a high rate. Baruch Hashem, the mortality due right now to COVID-19 is less than the mortality that we experienced back in the months of April and May. And there's some very optimistic things that I'm going to tell you later tonight still. But it's very important to realize that we are seeing deaths still occurring. We're now over 1,000 deaths a day in the United States. We hadn't seen those numbers in a long time. We're seeing more than 1,000 people, Rahman al-Islam, dying every day in the United States from COVID. What's going on in our local area? So all of you are aware, it's in the press, it's in the news. New York City will probably, it's not decided yet, but will probably be closing their school system because they're at a rate of 2.8 something percent. And if they go above 3, the teacher unions and the city have made an agreement that they're going to close all the schools in the city if they go above 3. I don't know what this will mean for the yeshivas. I really don't know what is going to happen. I'm not a Navi, but it certainly isn't good. In terms of Nassau County, we're above that magic number of 3, but that's not a medical number. And the county has decided at this point in time not to mandate that the public schools close, and it's each a separate decision. The Catholic schools in the city have decided to close. Some public schools have decided to close. The yeshivas, Baruch Hashem, are still open. But as I've stressed over and over, if we're not careful, we're putting yeshivas at risk. We're putting our schools being open at risk because at some point in time, if the numbers continue the way they are, unfortunately, the government will close down the yeshivas again. And that's the last thing that anybody wants. They've already made very strict restrictions in terms of 10 people, gatherings of 10 people. It hasn't impacted yet minyanim. We certainly hope and pray that we don't have to go back to those very sad days when we weren't able to daven tefillah b'tzibur. The numbers that we're seeing right now in the country are worse than they were when we shut the yeshivas and we shut the shuls back in April. So this is a dangerous territory that we're in. In our local Nassau County community here in the 5 towns, the rates still remain very high. And we're seeing the 5 towns, again, being very high compared to most of the other neighboring areas in terms of the incidence of cases per 100,000 people living in the community. We are seeing at the local hospitals a huge increase of hospitalized patients. Baruch Hashem, nowhere near what it was in March and April. But in the summer, we were averaging a census of 1 to 2 patients a day. Over the last month, we've seen that number increase. We went up to a handful each day, 5. We went up to 10. We went up to 15. And now we're running a census of at least 15 to 20 patients that we know about each day in the hospital. All the local hospitals are seeing this increase as well. And in the city, the numbers are even worse. We have recreated a COVID unit at the hospital. So have other hospitals. We are dealing with increased exposures that we're having to deal with. And Baruch Hashem, many of the patients that previously would have been hospitalized are not hospitalized at this point in time. We're able to manage them as outpatients better than we were able to originally when we didn't know the natural course of the infection, and we didn't have some of the techniques that we could to help breathe these patients without having to bring them into the hospital and without having to put them on ventilators. But this is not to say that we're not seeing a huge increase. To have a census of 20 versus a census of 2 is 10 times as many inpatients. And that, unfortunately, if you look at the number of cases in the area, those numbers are probably going to get higher and not lower based upon the number of new cases in the community, which takes a week to 2 to 3 weeks to reflect patients in the hospital and Nebuch patients in the ICU. We have patients in our ICUs right now, from patients in our ICUs, as well as non-religious, non-Jewish patients in our ICUs that have COVID. We have people on respirators. We have members of our shul. They should all have a refuah shlema. We need to understand that what we do as a community impacts all the people. And they're not older people in the hospital. They're people of all ages. We see people that are having risk factors at younger ages in the hospital as well. And even people that, Baruch Hashem, don't require hospitalization. We're learning more and more about this illness in terms of some of the long-term consequences in the immediate months right after illness. A very significant number of patients are having persistent symptoms, are having fatigue, are having difficulty with memory. Well, some people are referring to as a brain fog. People are having cardiac problems. And these are people that weren't necessarily hospitalized. These are people that weren't necessarily in the ICU on a respirator. So even though they had, quote, milder illness, sometimes the long-term consequences that these patients are suffering, and we hope that they're not long-term. We don't know the long-term course. This illness has been around for 8 months in our area. So we don't know the longer-term consequences, but we are seeing a significant number of patients, some estimates about a quarter to a third of the patients having some significant persistent symptoms that are of concern because we don't know when they'll go away and if they're going to leave the people with any sort of a long-term damage or consequences as a result of that. That's the bad news part of the talk tonight. But I think that I wanted this originally. I wish the numbers were better, that this could have been a totally optimistic talk, because I am extremely optimistic that we are seeing the light, or at least the beginning of the light at the end of the tunnel. I expect this week that the data from the Pfizer study will be published and it will be able to be reviewed. And the preliminary press releases, which there's no reason to think aren't accurate, and if the data are as the press releases suggest, and the data is visible to everyone and able to be studied and analyzed, I expect the FDA will approve emergency use authorization or an actual approval of the vaccine that Pfizer is making. This vaccine has very, very nicely shown a 90% ability to prevent COVID. Now, this is not antibody testing, which it does produce wonderful antibodies in the laboratory. We can check the person and show in the laboratory they have antibodies that this virus is generating. But in actual clinical cases, we've seen that 90% of the infections were prevented. In other words, in the placebo group who got sugar water, didn't get any active vaccine, they had 90% more cases of COVID occurring, clinical cases of COVID, than in the treatment, the vaccine group, where they had a much smaller number. So it was 90% effective in preventing people from getting COVID. This is a phenomenal vaccine if these are the numbers. The normal measles vaccine, which is a great vaccine, by one dose gives you a 93% immunity rate. With 2 doses, it gives you a 97% immunity rate. If this vaccine is anywhere near that ballpark, so then it's a phenomenally good vaccine. And there were no significant side effects reported so far. And there were no differences in side effects between the placebo, the people that didn't get active vaccine, and those that got vaccine, which is extremely reassuring. Similarly, the China vaccine, which was stopped in Brazil, has been restarted. They didn't feel that the side effect that was associated with that vaccine was really due to the vaccine, and they're continuing their vaccine studies. The Russian Sputnik vaccine, the Sputnik 5 vaccine, reported, again, without the data being given with it, but they reported a 92% effective rate of preventing COVID, which is, again, phenomenal. Now, even though we're not going to be using the Russian vaccine nor the Chinese vaccine here in the United States, the more people across the world that have an effective vaccine, if the people in Russia, the people in China have an effective vaccine and it's being given and distributed to them, that bodes well for everybody in the world. The Moderna data from their mRNA vaccine will hopefully be available this week, if not this week, next week. They've completed their enrollment and now they're analyzing their data. And that's very exciting because that's a mRNA vaccine, which is a unique type of vaccine similar to the Pfizer vaccine, for which we don't ever have experience with such vaccines. So it's very reassuring to see how safe they are so far and how effective they are so far. This technology could have tremendous ramifications for vaccines for other illnesses as well. It's very fortuitous that they preliminarily looked so good in COVID, and that this could, in fact, work against tuberculosis or work against other illnesses for which we've been very unsuccessful in terms of making a vaccine. So this could have a tremendous benefit for society as well. But let's focus on COVID. If these 2 vaccines get preliminary approval or full approval to be distributed, there are already plans in place at my hospital and at other hospitals across the country to distribute the vaccine. We purchased a special minus 80 degrees centigrade refrigerator. That's almost 100 degrees below 0 Fahrenheit. And you need to store this vaccine. You then need to be able to figure out how to distribute it and get it to the people so they can get the benefit from this vaccine. The first people that will be getting it will be people like me, like doctors, nurses, people on the front lines who are at the greatest risk. And those doses will go to them first. And then afterwards, they'll go to first responders, EMT, Hatzalah people, as well as people in nursing homes, as well as the highest risk patients. And by then we should have, B'ezras Hashem, even more experience showing the safety and the efficacy of these vaccines. So I think it's extremely, extremely good news. Again, I don't want to jump ahead. I want to wait to see till it's published. But what makes me very sad, what makes me extremely sad, is that people are already refusing to take the vaccine. And people, there was a supplement in a paper in Eretz Yisrael, which had a huge insertion in the newspaper saying that this vaccine is something that the secular world is trying to do to the frum community. That this vaccine is not an effective vaccine. That this vaccine is going to cause all sorts of problems. In this article, it said it's going to sterilize the Jewish people. There is unfortunately no way other than education to combat lack of education and lack of understanding of scientific principles. The same people that don't want people to take a vaccine are the same people that tell you don't wear a mask. They're the same people that tell you you don't have to socially distance. The authors of that Barrington paper, well, one of them has already retracted and said, I never meant to say that you shouldn't mask and socially distance. I was just saying natural immunity is something that may be helpful as well. I am unaware of a single reputable infectious diseases physician or public health official anywhere in the United States or across the world that disagrees with the concept of vaccines, that disagrees with the concept of masking and social distancing. You have not a simple majority. You have ruba deruba, if not unanimity, if not a unanimous scientific opinion of the value for the people that know of masking and social distancing. And when the vaccine becomes available, if the data are there, then the experts are going to recommend that it be used, and it will save lives. And people that choose not to take it, that's their choice, unfortunately. But again, as with all vaccines that require herd immunity or require a large percentage of the population to be protected before the whole population gets protected, so then unfortunately, it's going to be sad if we don't reach the numbers that are needed to get this herd immunity in place and Be'ezus Hashem break the back of this horrific pandemic. But there's even more good news besides the vaccine. And the AstraZeneca vaccine candidate and the Janssen, the J&J vaccine candidate, they're going to be doing their preliminary analysis of the phase 3 in the upcoming weeks, and those should be available as well, probably in early 2021. We're hoping that we'll actually be giving vaccine to people like myself and healthcare workers in December of 2020. That's how close we are, Be'ezus Hashem. It's not going to change things overnight, but it will make a difference. And the more people that get vaccinated, the better it will be. But right now, probably available this week because it got FDA emergency use authorization last week, is a monoclonal antibody that's produced by Lilly. This was the one that Governor Christie took, not the one that President Trump took. That's the Regeneron product, which will also probably get emergency use authorization very shortly based upon their preliminary data. But this Lilly product called bamlanivimab has shown in a published New England Journal of Medicine paper that it is very effective in healthy people who just get COVID on the initial days, that it can prevent serious deterioration in the highest risk patients. And they showed in their study that instead of 6% of those people getting hospitalized, only 1% of those patients got hospitalized after they took this treatment, this monoclonal antibody, which is an infusion. It requires an IV, requires being done under appropriate managed setting like a hospital has or possibly other facilities might be able to have. And this monoclonal antibody can be an extremely effective way for the highest risk patients to go and not get sick, even though they have gotten COVID. Now, there's certainly not a license to stop wearing a mask and to not socially distance. But Rahman al-Islam, people who wear a mask and socially distance still can sometimes come down with this illness. It's not perfect. And when they do, Rahman al-Islam, if they do get this illness, so this treatment will hopefully be very effective in preventing them from getting sick and preventing them from getting hospitalized and Rahman al-Islam worse. Now, this treatment will only be available in an extremely limited fashion. The state is talking about giving hospitals a couple of doses. And we spent a lot of the last week putting together policies to see how we would have most effectively used the limited number of doses that we would get. Each hospital will have to figure out a way to do this. And only the highest risk patients will be eligible to get this because they'll be the ones that will get the most benefit. Eventually, Be'ezus Hashem, when there is more of this monoclonal antibody, both from Lilly and hopefully from Regeneron, so then even more people will be able to get it. And the criteria for its usage will not have to be so limited. But again, this is the light at the end of the tunnel. If you combine a vaccine with effective therapies like bamlanivimab, and if you combine it with other monoclonal antibodies like the Regeneron product, and if you combine it with some potential oral agents, there's an oral agent called fluvoxamicin that was just studied in a double-blind placebo study that actually showed benefit as well, and that's an oral agent. There is nasal remdesivir that is being trialed. And if all of these therapies, in fact, come on board, so then the hope, Be'ezus Hashem, would be that we can really defeat this virus. But it still is several months away, if not longer, from the points where we'll be able to say, we no longer have to mask a social distance. If even at that point, we'll be able to say something like that. And I can't stress enough that if people wish to get through this without further significant illness and death and closure of shuls, closure of yeshivas, closure of shuls, closure of life, of businesses, so then now more than ever is a time not to become pandemic fatigued. Now more than ever is a time not to listen to ignorant people who say, don't wear a mask, to listen to people that say, don't get tested. If you get sick now, why would you want to get tested? We now have therapies that if people have a positive PCR test and they meet the risk factors, so then they would be able to potentially get this life-saving therapy. If we don't test people, we can't appropriately isolate and quarantine people. We should be listening to the professionals, to the knowledgeable infectious disease public health people, and not listening to people who have no right to voice their opinion. They have no education, they have no background, and because they've read something on the internet doesn't make them a halachic viewpoint, even if the word rabbi is in front of the name, and it certainly doesn't make them a medical expert with or without the word doctor in front of their name. I want to point out just a study in Nature that said that most of the spread that we're seeing right now is coming from restaurants, gyms, coffee shops, gatherings of people where masks aren't being worn. Small gatherings, large gatherings, they're all the same. That's the place where spread is occurring. We're not seeing huge spread in the yeshivas. We're not seeing huge spreads in schools because most of those children are being masked at the time. In certain situations, even when the people are breaking the rules, they're just not spread. Not everybody is capable of spreading, of being a super spreader. In fact, there's probably a minority of people that are very efficient at spreading illness. You just don't know who that is beforehand. And therefore, it's extremely important that everybody, and the more people that listen to me, and unfortunately, I've been proven 100% correct by the facts across the country, across the world. The more people that listen to masking and social distancing, and especially as we go into the winter months, where people will be indoors more, and to be careful, and to not have some of those gatherings that we would love to have with food. And maybe when we have a gathering, if it still can be outdoors, kol hakavod, that's better. And if it has to be indoors, we need to have lives. I understand that. So it needs to be distance with a smaller number of people and maybe not with food so everybody can remain masked. When children have to get together, because children are children, they need play dates, they need opportunities to get together with other friends. So then the adults that are there must mask, and the adults should stay away from the children that aren't their own children as best as possible. And where the children can go outdoors, they should be playing outdoors better than indoors. Common sense, seichel, so we don't have to shut down. That's B'ezras Hashem, the way that we'll get out of this pandemic. And Baruch Hashem, there was a study in Lancet Child and Adolescent Health that did seem to suggest that babies have almost no likelihood of transmitting, and they do, Baruch Hashem, very well. And younger kids are less likely to transmit than older kids. So I'll take questions at this point in time. I would just like to also mention that we have another program tonight, so I'll only take questions for a few minutes. It's on a different Zoom channel. Our shul, in conjunction with 7 other shuls in the OU, is going to have a weekly conversation with the Rav of the shul and an interesting person in the congregation. Tonight, our shul has the zechus to lead off with Rabbi Axelrod Shlita, the rabbi of the Young Israel of Woodmere, speaking with one of our wonderful congregants and a friend, Tuvia Lefkowitz, and that's at 8:15. And I think the Zoom information is put up on the chat as well. It's a different Zoom channel. It's not going to continue on here, but I want to give people an opportunity to go to that Zoom and listen to that very interesting talk. And I'll take questions for a couple of minutes. Reb Shmuel.
Okay. Rabbi, there's a few questions about the vaccine, as you mentioned. So I'm going to give you maybe 3 questions about the vaccine. First question, does the vaccine provide permanent immunity, or do we have to take it annually? Question number 1. Question number 2.
So do one at a time.
Okay, that's the first one.
So that we don't know. What we know, I'll tell you. What we don't know, I'm also happy to tell you. We have no idea how long this vaccine's benefits will last. There's no way to guess. There's no way to know for certain. It's a brand new methodology. This mRNA technology is brand new, and it's very exciting. We do not know how long it will last. If it lasts for X number of months, it's phenomenal. And if you need to get a booster shot, not a big deal if the vaccine is effective and safe.
Number 2, if someone had COVID, do they still need to get the vaccine?
So that's another very good question and unknown, but at this point in time, I'm waiting for the official recommendations. I don't think I would recommend that somebody who had COVID get the vaccine for two reasons. One, we'd like to give the doses to people that are much less likely to get COVID, and somebody who's had COVID in the past, while they could get it again, is much, much less likely to get COVID again. And we don't know what would happen if you gave a vaccine to somebody who previously had COVID. So I'm waiting for more data on that. But at the initial time, I think that my recommendation would be not to give the vaccine to somebody who previously had COVID.
And finally, so I think this is something on everybody's mind. When and how will we know that the vaccine is safe for us to take?
So the first huge piece of data will be released this week in the preliminary press release from Pfizer, which is no reason to think that they're lying because they're going to have to show the data, was that there was no difference in side effects between the placebo group and the vaccine. So 20+ thousand who got the vaccine had exactly the same side effects as the 20+ thousand who got the placebo, who got the sugar water in the vaccine. Now, if an event is going to occur 1 in a 100,000 chance and it's due to the vaccine, obviously there's only a 1 in 5 chance that if you gave it to 20,000 people, it will show up. So it is very possible that very low likelihood, very rare types of vaccine reactions could occur. Well, guess what? We will find that out, unfortunately, when they do occur, if they do occur. But you weigh that against the benefit, the number of lives that will have been saved from people who otherwise might have gotten COVID and would have potentially gotten very sick and had all the complications, including possibly being hospitalized on a ventilator and Rahman al-Islam dying. And you weigh that against a risk that's an unknown risk, because we don't know that anybody will get a 1 in 100,000. We have no idea. We have no evidence to suggest that these very, very rare or unusual vaccine side effects will occur. But again, when we start giving it to more people, those side effects will be monitored. So if we give it to 50,000 healthcare workers, 100,000 healthcare workers, and then there are no additional side effects noted. So that gives us additional proof of the safety of these vaccines. I will tell you that there was a paper published last year in the Annals of Internal Medicine, which showed that overall, the unbelievable safety of vaccines in the last 20 to 30 years. So despite the anti-vaxxer talk, there is no evidence to suggest that vaccines are significantly a danger from all of the vaccines that we've had. There's only been 1 or 2 vaccines that have ever had to be taken off, and the problems and complications with them were not of such a serious nature. They just weren't as effective, and they had some problems associated with them. But the vast majority of vaccines that we've had historically have been very good and safe and have saved countless lives. The measles vaccine, the polio vaccine, they saved tens of millions of lives. Our hope is that with the COVID vaccine, we can make the horrific numbers that we have of deaths right now not go any higher.
Okay. The next question, you've spoken about it many times, but people in the chat still want to hear it. And I'm sorry I even have to ask you the question. But should yeshivas be mandating mask wearing for both staff and students?
So again, the students, it depends on the age, and each yeshiva has its own medical committee and has to figure out what's best. My approach is the staff absolutely should be wearing, for their own protection, they should be wearing a mask and some sort of eye protection, either goggles or a face shield. That's to protect them. Masks this week, the CDC said, not only protect others from you, but you also get protection from it as well. So again, the wearing of masks by teachers or staff is an absolute. I don't know why anybody would not. They're putting themselves at risk if they don't. In terms of the students, you have to look at the age of the students. In a preschool type of a setting, I don't think the masks are going to be effective because they're not going to be worn properly. And at what point, at what age, the children are capable of wearing a mask for as long as they possibly can. Each school, each yeshiva, each medical group that's advising the schools needs to come up with their own decisions. I don't think there's one size that fits all. I don't think there's one simple answer. Obviously, if it's a very closed, compact room without windows, the answer might be different than if you have a more spacious room, or certainly in some parts of the country you can learn outdoors still.
Speaking of masks, the Synovia masks are advertised as killing COVID. Any truth to that?
So I don't have any published data. I've been asked this question a lot of times. whenever anybody asks these types of questions, if the company isn't showing you links to published data, then there is no data. And I'm not aware of any data showing that these masks prevent COVID more than any other mask. Now, in a laboratory setting, you can show that certain chemicals may or may not be effective in eradicating a bacteria or a virus, but that doesn't translate to meaning that when you wear such a mask, that it in fact will have any benefit whatsoever. So I recommend people wear a surgical 3-ply mask or a cloth 3-ply mask. And until somebody shows data that a certain mask is better than another mask, you're paying money for something that has no proven efficacy. That's not to say it doesn't work. I just don't have any data to recommend its routine usage, especially if it's an expensive product that people are making money off of, trying to get you to buy their product without any data.
In your hospital, how many cases of reinfection are you seeing, or are the new cases those who never had COVID before?
So the majority of cases are new cases of COVID. Again, second cases of COVID remain quite rare. They're possible, but they remain quite rare. And we really don't have the technology to easily distinguish sometimes whether it's a repeat of the first COVID and it's never gone away, or is this a brand new episode of COVID? So only when that very high level of technology is capable of being done on the first and second samples of virus that are identified can you make a definitive statement. But I would say certainly the vast majority of new cases right now are new COVID cases and not second COVID cases.
With Thanksgiving coming up, could you comment on Thanksgiving get-togethers and what precautions should be taken?
So the absolute cautions that I've been mentioning for food gatherings absolutely apply to Thanksgiving. And I've been interviewed on a number of different channels for secular holidays coming up, as well as Thanksgiving, as well as other holidays from different religions. And the answer is the same, whether it's Pesach or whether it's a different holiday, whether it's Thanksgiving, whether it's a gathering that multiple people who aren't normally exposed to each other, not living in the same household, are coming together, unmasked, eating and conversing in close proximity. Those are what we call potential super spreader events. Now, you may get lucky. And in fact, probably the majority of times, they're not going to be super spreader events. But in some of those situations, you'll get 100% of the people there infected and sick to a certain extent, depending on their underlying risk factors. And it's taking a risk. And I tell people, it's just a little bit longer. We're not talking about doing this for the rest of our lives, Be'ezus Hashem. We're not talking about doing this, hopefully, for months and months and months beyond the upcoming months. If we are successful with a vaccine, if we are successful with these monoclonal antibodies and some of the other agents that I mentioned, if we do develop a significant level of herd immunity because of the vaccine, natural illness, as well as the ability to treat people who get early illness with effective agents, then we're looking at the end of this epidemic. But it's not going to happen overnight. And if we keep on adding fuel to the fire, if we have a huge spike after Thanksgiving, if we have after Hanukkah a huge spike, if we have after the Goyish holidays a huge spike, it's going to make it that much more difficult for hospitals. It's going to make it that much more difficult for the staff in the hospitals to be able to take care of themselves as well as take care of the people that they're committed to taking care of.
Okay, and last question.
One more question, yeah.
Yeah, last question. Do reactions run in families? Meaning, if a person has COVID and the sibling has a COVID, you see that they have the same symptoms, or is it just varied? It doesn't depend on familial togetherness.
So it's an unknown. When COVID goes in the family, we've seen numerous cases where everybody in the family gets sick and there's different levels of illness. Some people can be very sick, some people get mild illness, and some people are asymptomatic. And we just test them and, oh yeah, they were positive also. In other families, everybody gets sick. We don't know why. It probably has a lot to do with the actual strain. It probably has a lot to do with the immune systems of the people. It has to do with probably the dose, or what we call the inoculum effect, how much they were exposed. an additional huge benefit of wearing a mask is even if you do get exposed, there are data. It's not proven yet, but there are data to suggest that you'll get milder illness. You may get exposed to less virus because the mask will filter out some, and the person wearing a mask will filter out some of the virus. So you're getting a lower dose, what we call a lower inoculum. And we know in certain other diseases that the inoculum effect is very important. Your body can handle a smaller invasion. It can't handle a large invasion. And therefore, if that's true for COVID, the additional benefits of wearing a mask would be, even if you do get sick, maybe you'll get milder illness. And there are older people that get very mild illness, and there are younger people that get very severe illness. And there are younger people that have significant, longer problems with COVID. So people who are young should not think that this isn't an illness they need to be concerned about. Nobody should assume that getting COVID is an easy, simple thing, no matter how young and healthy you are. And Be'ezus Hashem, with some of the therapies that we have, older people, they shouldn't take off their masks and stop distancing and do whatever they want to do that they did previously. They should still maintain the wonderful adherence to the guidelines that we're seeing in the older population. We're seeing very few older people coming into the hospital. At the same time, if they do get infected, so there is therapy for them that I think will hopefully be available starting this week, and potentially as soon as we have enough doses, we can give it to everybody that would meet the criteria for getting this new exciting therapy.
Okay, thank you very much, Rabbi Glatt. I want to remind everybody that Rabbi Axelrod on the other Zoom channel, which is posted in the chat, will be in conversation with Tuvia Lefkowitz. Everybody is invited to hear Rabbi Axelrod and Tuvia Lefkowitz. Thank you very much, Rabbi Glatt, and good luck to everybody.
Have a good Vach, everybody. Good night.